Welcome to The Explainer. Today, we're doing something a bit different. We are going to step into the shoes of medical detectives. That's right. Our mission today is to learn how to really observe, listen, and decode those subtle, silent clues our bodies give us, way before they ever have the chance to turn into loud, blaring alarms. It's all about catching the whispers before they become shouts. To understand the massive scale of the medical puzzle we're looking at, let's start with a number that is, frankly, pretty staggering: 14.1 million. That was the estimated number of new cancer cases globally in the year 2012 alone. That encompasses common battles like lung, breast, bowel, and prostate cancers. It is a colossal number, and it brilliantly illustrates why recognizing illness early isn't just a good idea, it's an absolute urgent necessity. Here's our roadmap for the explainer today. We're going to look at silent warning signals, cancer in young people, alarms from the stomach, sorting out a sore throat versus cancer, and finally, actions for prevention. Let's dive in. Part 1. Silent warning signals. Think of your body like a brilliantly smart machine. When something's off, it leaves clues. But, we're all busy, so we tend to brush them off easily. Dropping over 5% of your body weight in a few months without even trying? Or getting strangely winded just sitting there resting? Even a tiny scrape that just refuses to heal, or waking up completely drenched in night sweats. These aren't just random annoyances. They can actually be the very first subtle whispers of something serious going on with your bones, your liver, or your blood. So, how do you tell a minor glitch from a major clue? Well, you use your ultimate master detective tool, the 2-week rule. Listen, having a cough, a raspy voice, or slight changes in your bathroom habits, totally natural. But if those supposedly normal symptoms stubbornly stick around for 2 to 6 weeks, that's when they graduate from normal to highly suspicious. And that is the exact moment you need to loop a doctor into your investigation. Moving to Section 2, Cancer in Young People. We've got to confront a pretty surprising reality regarding this demographic. Nearly 9% of new breast cancer cases every single year hit women under the age of 45. 9%! It's a stark reminder that doing home self-checks and paying attention to even the tiniest bodily changes isn't just something for older folks to worry about. It is a vital modern survival skill for the young, too. But hey, there is tremendous hope in this investigation, too. Take testicular cancer, for example, which is actually very common in guys between 20 and 34. If young men take the initiative and catch a strange, painless lump early on, the cure rate at that initial stage is over 95%. That's a massive win, and it proves exactly why early detection is our absolute best weapon. And check out this data from Harvard University. It really drives the point home for anyone who's young and constantly on the go. They found that 62% of patients with acute leukemia experienced totally unexplained exhaustion for weeks before they were diagnosed. And I'm not talking about the regular tiredness you feel after pulling an all-nighter or chasing a crazy deadline. We're talking persistent, bone-deep exhaustion. That is something you should never, ever ignore. All right, Section 3, Alarms from the Stomach. So why are stomach issues so incredibly stealthy and hard to track down early on? Well, it comes down to basic anatomy. Our stomachs are super elastic, which is great for holding a big meal, right? But that same wonderful flexibility accidentally creates this vast, hidden, dark room. Because it's such a spacious, expandable environment, tumors can actually grow silently for a really long time without causing any major pressure or severe pain in those early stages. Because of that anatomical dilemma, the clues your stomach does manage to send out are super easy to overlook. We're talking about things like feeling totally stuffed after just a few bites of food, or having relentless heartburn that standard antacids won't even touch. Maybe it's a dull ache in your upper belly, or, and this is a huge red flag, stool that looks dark or black like tar. Seriously, please do not just dismiss these as a simple case of indigestion. Your body is trying to tell you something important. Section 4, is it a sore throat or is it cancer? Moving up the body, the boundary line between a standard bug and a life-or-death situation can get a little blurry. A normal, run-of-the-mill viral sore throat is going to neatly wrap up and vanish in under 2 weeks. But if it's an early warning for throat or laryngeal cancer, that issue is going to drag on well past the 2 to 3 week mark. Plus, it often brings along uninvited guests, like sudden weight loss, congestion on just one side of your nose, or this strange pain that shoots all the way out to your ear. Associate Professor Dr. Vo Thanh Quang shared a golden rule that I really want to highlight for you. If you suddenly get persistently hoarse or lose your voice, but you have zero flu symptoms, like no cough, no fever at all, That is a premier critical early warning for laryngeal cancer. Why? Because practically 85% of these tumors start right smack on the vocal cords themselves. Even a microscopic growth in that hypersensitive spot is going to instantly alter your voice. What again? Knowing this puts the power right back in your hands. If you act on that weird, hoarse voice and catch laryngeal cancer in its early stage, the 5-year survival rate is a phenomenal 90% or higher. And the best part? Patients typically retain their full ability to speak and swallow normally. Acting fast literally saves your voice and your life. Finally, Section 5, Actions for Prevention. Now that we know how to read the clues, let's turn this knowledge into an unbreakable shield. The absolute bedrock of prevention is sticking to a strict screening schedule. For women in their 20s, it's all about regular pap smears. Once you hit 30, you add an HPV test to the mix to build a highly fortified wall against cervical cancer. And for everyone, modern medicine strongly urges that the minute you turn 45, you step up and get a colonoscopy. I know changes in bathroom habits are easy to ignore, but that age 45 colonoscopy catches anomalies dead in their tracks, long before they can turn sinister. Of course, the doctor's office isn't your only line of defense, right? Your daily lifestyle is your everyday armor. Put down the cigarettes, cut back on the drinks, and open up your fridge. Loading your diet with fresh tomatoes, juicy citrus fruits, olive oil, and fish oil isn't just about eating well. These are literally nature's cheapest, most effective long-term medicines. They give you lasting protection right down to the cellular level. And that brings us to the end of our investigation. Before we wrap up this explainer, I want to leave you with one final vital thought. Your body is your most loyal companion, and it is quietly whispering to you every single day. So what is your body saying right now? And are you finally ready to slow down, listen closely to those silent signals, and take proactive control of your health? Remember, the power of early detection belongs entirely to you. Thanks for joining me today, and keep listening to those clues.